Hello, my name is Anaya Webb, and this is my week 4 return to demonstration over the eyes, ears, mouth, nose, and throat. I do not have a patient for this week's lab, so I will be using myself again. I just will be explaining the steps of my assessment, and for certain parts of the assessment, I will be using myself. Of course, I will start off with hand washing before I enter the patient's room. I will start off with aided. I will introduce myself to the patient. I will let them know I would explain the assessment and exactly what I'm going to do. I'll just let them know that I'll be assessing over their eyes, ears, nose, mouth, and throat, and that it will take to about 5 to 10 minutes. And I will thank them for their cooperation and participating as I am completing my assessment. So first, I will start off with assessing the patient's visual change, and I will use the Snellen eye chart for that. And if there are no abnormal findings with that chart, I will note that the patient has 20/20 vision and their vision is normal. After that, I would inspect their internal eye. I will look at their eyelids and their eyebrows. I will check to see if there's any deformities or lesions or any type of edema. I will note if their eyebrows are they have normal hair distribution throughout their eyebrows and their eyelashes. And I will note that their sclera and their conjunctiva, the sclera is white and the conjunctiva is pink and it's moist. So if all those things are normal, those are things that I would note. If there are any abnormal findings, of course, I would note those. I will also check for their pupils. I will inspect their pupils, and when you're inspecting for pupils, you use Perla. I hope I'm saying that right. You will use Perla, and basically I would inspect that, their pupils are equal, they're round, they react to light and accommodation. So I would note that those are normal findings within their pupils. Next, I will inspect their extraocular muscle, and I will for those, I will use 2 tests for those. The first test is I will check their corneal light reflex. Basically, with that, I will have the patient, I will stand so many feet apart from them, and I would shine like a pin light, and I would notice if they have a symmetrical light reflection in their eyes. So I would note if that is normal, if you can see the light in the same spot in both eyelids. In both eyeballs. I would note that. I would also check for their extraocular movement by using the 6 cardinal position gaze. I would note that is normal. I would note that their extraocular muscle is intact. And for that testing, I will kind of just have them look in 6 different angles. And I would note that they're if that finding is normal, I would know that there's no like stigmatis or anything. So that would note that their extraocular muscle is intact. After that, I will I will inspect and palpate their external ear. So I would look at their ear and make sure that it's symmetrical to their facial features, that they're both bilateral. They have the color distribution is, matches their skin, that there is no lesions or drainage from their ear. I would note that if they have any piercings, of course, I have earrings, you would check around those piercings and make sure that they, no infestations or anything in those. I would palpate and check to make sure there is no swelling or edema or pain in their ear. So I would just kind of feel around for that. I would also use the otoscope, and I would check to make sure that their tympanic membrane is intact. You can only see that with looking within their ear through an otoscope. Next, I would check for hearing loss when you're checking for the ears. For hearing loss, you have 2 tests. You have the Weber test and Rhine test. I hope I'm saying that right. So with the Weber test, you have a tuning fork, and you would kind of hit it, and you would place it on the top of their head, and they should have the sound should be distributed through both of their ears. And if they don't have any abnormal findings with that, if they're hearing the sound through both of their ears, I would note that there is no lateralization. For the Rhine test, I would take a tuning fork and I would tap it and I would place it on the side of their head. And with that just it it's a test to know if, you know, they're hearing the sound in their ear is twice as long by air conduction as into bone conduction. So if there is no abnormal findings with that, I would note that there's a 2-to-1 ratio air conduction to bone conduction. So those are the two tests that I would use to test for their hearing loss. Next, I would inspect and palpate the nose. So of course, I would make sure their nose is symmetrical to their face and that the color is consistent throughout. I would palpate and make sure there's no signs of, you can see if their nose is swelling, but you can palpate and make sure there is no pain or anything. I would look at their nose and make sure that they don't have any types of lesions or infestations, and I can tell if their nose is deformed, so that's something I can see on inspecting it, sorry. I will also check for like if they have piercings. Some people do have nose piercings, so of course I will look around their piercings and make sure that there's no type of infections or lesions with that. Next, I would inspect and palpate the sinuses. So for your sinuses, you have your frontal sinus, your maxillary sinus, and basically I would inspect those and make sure that there are no that their sinuses are non-tender, there's no pain or anything. So also I would check for transillumination. That's something that you can just see, so that's something that I would inspect. Next, I would inspect the mouth and the throat. So I would look, of course, look into their mouth and make sure there's no signs of lesions or infestations, that their lips and tongue and mucous membrane are pink and moist. Also, I would check to make sure that everything within their mouth is intact. I would check for their tonsils, make sure their tonsils is at a normal range, which would be 1+. So I can look with their tonsils with the pen light and look for that, make sure there's no swelling in that. I will also check for the patient's gag reflex. So if there is no abnormal findings with that, I would state that there is no gag reflex. And I would state that their gag reflex is present. I will also look and make sure that they have all 32 teeth present, that there is no decay or any missing teeth or anything like that. So that would be the last thing that I would do. So once I complete my assessment, I will in the assessment with Roth, of course, I will reassure that the patient isn't having any pain. I will offer comfort measures. I will offer comfort measures, and I will ask the patient if there's anything extra that they need. Of course, I would thank them for allowing me to complete my assessment, and I would end the assessment with letting them know if they have any questions, make sure they contact us, always come back and see us, and then I will end with hand hygiene. So, thank you.